Hi guys, we've gotten a lot of questions on our DMs about lip lifts, so I would like to answer some of them for you. In the last 5 years, with the advent of social media and being able to show what a lip lift does, and because there's so much bad fillers out there, that surgical answer to it gained some popularity. So overall, in the right patients, it's amazing, it's permanent, and it's one of the most powerful aesthetic procedures that I do for the face. Does a lip lift make lips look more plump and full like a filler? And the answer to that is yes, because you're cutting out tissue, you're shortening this distance, and you're turning the lower lip up without adding volume. So actually it makes it a more natural fullness. So in many cases I prefer a lip lift over a regular filler if this distance is too long. So that is no. Just like any other surgery, we have to evaluate you. We have to make sure that you have the proper distances here. You have the right idea of what it's going to achieve for you. You have to have realistic expectations. We assess. Sometimes you need as little as a little bit of lip filler. Sometimes you need nothing. And sometimes you need a lip lift, which is actually a surgical procedure that cuts out some skin from under your nose and on the top of your lip. So not everyone is a candidate. How do I know if I qualify for a lip lift? And just like with any other inquiry, we suggest that you set up a consultation, you speak to us, we evaluate you, we have to measure you, look at your face, look at the harmony of your face, look at what your goals are, especially with your lip, and then we decide what's the best course of treatment for you. Does the lip lift hurt and require anesthesia? The answer to the anesthesia part is yes. You do need local anesthesia. We do it right here in the office. It takes 30 minutes. And then after you're numbed up, it doesn't hurt and the recovery is really, really easy. Typical time course is you come in, you get the procedure done. It takes about half an hour in the office. Then you go home. There's really not much recovery, not much swelling. You come back about 4 days later to take a couple of sutures out, and 7 days later to take the rest of them out. By that time, the scar should be starting to fade or at least settle. And then at about 6 weeks, we might consider lasering. If you do it properly, if you eliminate any kind of tension on your scar, it should fade over time, let's say 3 months. And usually somewhere in the 3-month mark, if it's not fully gone or if it's gonna be problematic, we laser it for you. And indeed it is, because you're cutting out tissue, you're sewing it, so you're not depending on fillers that dissolve over time. This is tissue that's excised, you close the gap, and what you have, you keep it. So that should be no, because if you properly place your incision and relieve any kind of tension on the nose and sew the lip lift to the underlying smash, you shouldn't alter the way the nose appears. So the answer to that is no. But if somehow the incisions go around the nostrils and you end up putting tension on the nostrils, it could change the way the nose looks. Yes, I do those all the time. Usually though, it's better served if you can do a closed rhinoplasty, so you don't put an incision here on the columella and then do the lip lift incision, and then you have this little bridge of skin that has been cut on both sides. So closed rhinoplasty with a lip lift works great, do it all the time. You have one recovery and it's a great procedure. Usually, no. But if you have done a lip lift and you had a little line for an upper lip, and now you have a full upper lip because you did the lip lift and it turned your lip up and shortened this distance, sometimes the lower lip now looks weak in comparison and not balanced, so we have to add some to the lower lip. And rarely, some patients come back, once they have the right distance here, they want to accent the upper lip a little bit more, so sometimes you do need a little bit of filler. That's difficult because if you have a lot of tooth show to begin with, and then you try to lift it up, you're gonna have more tooth show. So for that, we would probably add some volume to the bottom of your lip and try to volumize it that way and turn it up that way instead of actually cutting out tissue and raising it.